Mbukele ekhaya seyigcwele insimbi yesithupha nsambama kusihlwa asinemukele siphinze sinivusele eluhlelweni lapho sikhulumisa khona tindzaba temkhuhlane i-COVID-19 libito lami nginguSibusiso Ngubane ngihambisana naMbongwa Dube. Mbukeli ekhaya ke namuhla ehlelweni sitawukhumbula ukuthi sifunza sakamanzini ngisona sihamba embili lapha Eswatini ngekuphetfuka kwawo umkhuhlane i-COVID-19 indzawo ke lapho uhulumende agcineke sekayikhomba ukuthi ngesilumbi singathi i-hotspot ngilapho lo mkhuhlane ophetfuke khona kakhulu njengoba tinombolo letinengi cishe ngetulu kwehalf yetinombolo letikhona lapha eveni tawo umkhuhlane i-COVID-19 tichamuka kamanzini kanti ke lokho kuholele ekutheni uhulumende asukumise umkhankaso wekungena iminyango neminyango lesingathi ngesilumbi i-door to door campaign lapho khona litiko litamake tindlela tekunciphisa kwanza kwalomkhuhlane njengoba kubonakala ukuthi unyuka ngesivinini lesisetulu kuso sifunza sakamanzini. Namuhla ke eluhlelweni we have Dr. Rodrick Shaw, who is part of the teams that are visiting Manzini, going door to door. Welcome, Doctor, on the show.
Thank you, Mr. Ngubane. Thank you for having me.
Doctor, just to introduce this campaign which has been launched by the ministry, the door-to-door campaign.
Yes. So we recently, yesterday, we initiated the door-to-door campaign that was initiated by the Ministry of Health. Its main purpose is to halt the spread of the new cases of COVID-19 in the Swazi region, but mostly in the hotspots of Swaziland, which is Manzini, and recently Hoho has been seen to be spiking. So with the door-to-door campaign, it has 6 main goals. It's got an FDIT approach that we can say, which it means to educate, to find, to test, to treat, and to isolate, and also to trace those contacts as well.
Maybe
Yes.
just to tell us the purpose of this campaign.
Okay, the purpose of this campaign is to break the chain of the spread of the COVID-19 and to reduce the curve in Swaziland that we are having. So we are mainly focusing on the hotspots right now because that's where we need most of the help, which is mainly the Manzini region and the Hoho region. The main purpose that we want to do is to isolate and treat symptomatically positive cases. We trace their contacts and we quarantine the suspects that are awaiting their results.
Kuyevakala dokotela maybe kumbe nekuchazela nje umbukele ngabe injongo yalomkhankaso yini.
Okay, lesifuna kwenda kahle sifuna ukuthi silandzelele bantfu labasemakhaya sihamba ngemnyango ukuthi si teste nekuthi sibone ukuthi bobani labagulako in each homestead, and in those homesteads we need to find out who is positive and who are the contacts of these patients. Yes. And we need
to nje maybe kungeta kulama objectives.
Kulama objectives. Okay. Sifuna kufunzisa nge COVID-19 kabanti, and we also want to prevent and control. And lokunye sifuna kwenda sifuna ukuthi si reinforce I case detection. Lokuthi sikhanze lama case lamanengi la kangwane. So that's why senda le door to door. Sifuna kutfola bonke abantu labanayo COVID-19. Nalokunye sifuna kwena sifuna investigator gabanti ngawo onke bantfu laba symptomatic. And another thing, labo lasithole ukuthi ba symptomatic kusho ukuthi labo labane tifo labane timpawu temkhuhlane. So those ones we want to isolate them, and once we've isolated them, we do investigations which send a swab, and then leyo swab we wait a couple of days, which is about 2 to 3 days. And then lapho impumela bese iyaphuma bese siyathola ukuthi ngabe lo muntu lona u positive noma u negative, and then bese siyachubeka from then onwards. Nangabe u positive loyo muntu loyo futeke simtreat noma sim isolate if they are high risk and so on. Yes.
Ngabe umuntu ekhaya nje unibona ngane ukuthi wo laba ngiyo le team lehamba door to door, or maybe sekutawuba nabantu who will take advantage of these maybe for evil things labangafuna kudena.
Ngiyabonga Ngubane kubuta lokho. Okay, so I campaign yethu we will mostly be identifying ukuthi sigcoke nama name tags nanga abhalwe Ministry of Health neligama lakho nebuso bakho lana since sonke sigcoke ama-mask ngeke usibone. Nalokunye sitabe sigcokile naga ema-reflectors. Reflectors lawa will make you easily identify us, and we will be mostly coming there to educate you and to teach you more on COVID-19 and also to screen you. If you screen positive, we will also test you, which is slightly different from the previous campaign that we had from the Red Cross.
Maybe to explain, what is the expected outcome of this campaign?
Okay, the expected outcome of this campaign, we want to increase the case findings. We want to increase the case finding. We want to isolate and treat 100% of all confirmed cases. At least 95% of, we need to trace at least 95% of all cases that are confirmed. And we need to isolate and test all of those that are high-risk contacts. Yes.
Okay, maybe
Those are the
to
main
explain the FTIT approach as you explained it.
Yes. Okay, so we have the 6 steps in the FTIT approach. So it's to educate. So with education, we want to make sure that people know exactly what is COVID-19, and we want to remove any misconceptions about COVID-19 since there are a lot of them out there. And we also want to FTIT. So the following one is find. We want to find. Finding has to do with screening. So basically what we are doing. So screening is asking several questions and figuring out, is this patient high risk or low risk, or are they symptomatically positive? So if you have flu-like symptoms, we will say you have screened positive and we would like to test you. And then that's when we go to the next step, which is testing. With testing, we will take a swab either from your nostril or from your throat, but mostly from the nostril. And we will take it to the laboratory to do findings, which will come back within 48 to 72 hours. And with these patients that we have already swabbed, we need to isolate them. Isolating means being away from the rest of your family, or do preventive measures, excessive preventive measures. And the next T is to treat. To treat, it depends on how the patient presents. If they are symptomatic, we need to isolate them. If the patient is a contact and they are asymptomatic, those ones we usually treat from home, basically by isolating these patients. Because as we know, with COVID-19, there is no cure for it. So with the treatment, we just do symptomatic treatment of all the things that we get with COVID-19. And the next step after that, as I would say, the treatment goes along with isolation, which goes to the next point. With isolation, meaning to isolate you, to put you alone, away from the general population and everyone else, to prevent the spread of the infection. And also, after we've isolated and we've found kuti nang positive, sifuna kwati kuti ngubani lona nangabe ngubani lona kuti who have they infected. Trace contact tracing. So contact tracing, we need to figure out kuti ngubani lomunye longabe uthelelwe. Yes, latsinzene nabo. Those are close family and friends, and also workmates. Usually people that you live in a close proximity with you.
Maybe briefly nje dokotela singakathathi imivo yesive lesikhulumisene nabo. Kule ndzaba ye contact tracing. Maybe kusichazela kafishane nje ukuthi nibuka kanjani nihambe nifikephi in terms of me being positive and my contact le bese niyawa trace.
Okay, I understand. So with contact tracing, how it basically happens is, okay, asithi wena Ngubane, God forbid, uba positive. Naso positive lokwendekako sibuka bonke abantu that were around you. And we have a screening tool whether a person is high risk or low risk. If a person is high risk, for instance, if you are here at work, we would say that person is within your vicinity within 1 meter for more than a period of 15 minutes with you. We would consider that person high risk. Or in a hospital setting, if a doctor or a nurse is wearing protective equipment, but there is a breach in that equipment and they are dealing with a COVID patient, we would say that person is high risk. And also, if you are in a kumbi with a person with COVID-19 positive case, within 2 to 3 seats around that person, you are at high risk. And then the opposite, when you are low, those patients, all of the patients that are high risk, these ones we want to test. So they may not have any flu-like symptoms, but we just want to test them to make sure that they do not have. So this is where we get most of our asymptomatic patients. I'm sure you've heard that term before.
Yes.
Yes. And then if they are low risk, meaning, for instance, the main one is I'm within 1 meter of you, but I spent less than 15 minutes with you. So that one, we would say that person is low risk. And others in the hospital, if you're wearing full PPE and there's no breach and you're dealing with a COVID positive patient, you are considered low risk as well. Or in a kumbi and everyone is wearing PPE, personal protective equipment like a mask, we would say these people are low risk. So low risk and high risk we treat differently. With low risk, we want to just give that patient, we explain exactly what is happening. We'd say, okay, you are a low risk, but you are at risk otherwise. So with these patients, we want them to have a symptom diary. You write, okay, namhla sengicala umkhuhlane. Naso cala umkhuhlane ke sifuna ukuthi uhambe uyobika kulabo betembiko. So you call 977 and then the rapid response team will come back to you and test you.
Okay.
Yes.
Kuyevakala dokotela Mbukele ekhaya solongihletike naye Dr. Rodrick Shaw lohola ke emabandla lahamba avakashela ke imiti kaManzini imimango lesingathi yi door to door campaign lapho khona kubonakele ukuthi kufuna kumbe hulumende anyuse limasela lalifakako kulwa nekwanza kwalomkhuhlane kwatise ke ukuthi Manzini lapho lomkhuhlane ubhedvuke kakhulu sekuhanjwa kungena eminyango neminyango emakhaya sithetheke lithuba sakhulumisana nabo labahlala kaManzini kuva imivo yabo ngalona mkhankaso asesive ukuthi bathini bona kaManzini.
Bangithinza lo ngoba cause kaManzini vele ngilapho khona siphela ngale COVID-19 noma sibukela khashane inkinga yethu sithi sendela abantu siyakhohlwa ukuthi iCovid-19 ikhona siqale sayibukela le ngishiye kwemava nyalo sefike eqatha sakithi mina lokhu lenikwentako ngicela kubonga ngilokuhle ngoba cause abantu le COVID basenga understand itholakala kanjani nabathi asalala endlini kukhulu ukuhlala endlini nasabathi asiphume sengaphandle njengoba nina sentakithi ngiyabonga mina kuhle nikwendawo sesitawuphepha sento khona ukuthi nisicheckele la endlini ngoba nawuva ukuthi uyaphuma edorobheni nala ku temperature kuhlekshintsha shintsha kukushiya ngabo 37 kukutshela ngabo 22
bahambe bangena eminyango neminyango bani umuntu uyasaba ukutest ngani ukutestwa ligciwane le-AIDS bayisaba nalamhla khona abangazange sebateste kodwa na bayadiva ukuthi bayehle emtimbeni.
Ngibona la kimi ngibona kukahle mina ngoba basita thina sive akusiyo into lembi nje leyo lokufunakala ukuthi abone umuntu atati lokuthi usesimweni lesikanjani kwasikhathi samanje ngilokubalelekile ke lokho.
Mina ngokuyibuka kwami yebo kona indaba yethu sonke sisho njalo siswati ukuthi indaba yethu sonke ngoba kufa lokuqhamuke singakabheki kungakabheki wonke umuntu manje ke nyalo sekuyinkinga ke bathi asambeni sohlala emakhaya sibe buqayi 1 meter away kujanyalo sengifa bathi sebatawuthumela tempilo betempilo bete kutosi checka emakhaya njani phela ngoba kuthiwa singalihambisi legciwane no kumina lesingasakufa kahle ngathi kuthi betempilo bakubuke njani nase bathi bona bahambe baye emakhaya bangene emakhaya ngemuntu phela lokho sekusho kona ukuthi alandele igciwane liqhubekele empilo kanti phela yathi nesonke sihlose ukuthi silinqobe ngaba ngiloko sisi ngokubuka kwami ngadi ke lomunye ukubuka njani lokho yena.
Okay letho ngathi uhulumende uthethe unyawo loluhle losangena umnyango ngemnyango because inkiyalo enkulu asiva sisodvana mnethu bakhuluma ngeligwayi bakhuluma ngechwala ngalivala echwala babambela natshwala bamvu babhemisana vele COVID asicethe kalongena ikhana ngelikhaya vele sitawuphepha lapho uyawubonakala ukuthi kwendakalana la emakhaya banenge labalala leCovid labahleli nayo emakhaya batheya labanye futhi ngalothu akutest yabo nyalo kuhle impela kwenda ngohulumende sakunqonqotha impela.
Ngicabanga ukuthi litiko letempilo lende info lenhle kakhulu ukuthi bacabange ukuthi bangenele bantu emakhaya ngaloko ukuthi bantu baningi labasemakhaya maybe labasakubako kuhamba kuyoti check ukuthi ngabe simo sabo sinjani loku sebaphakamele etuli betempile bahambe basi-check emakhaya. Ngicabanga ukuthi lakhona kutobonakala leli nani lebantu ukuthi bangakanani.
Kaya siphinze sikwemukele elohlelweni labo bekubantu labahlala kamanzini dokotela uyabeva bayakhuluma ngicabanga ukuthi liningi bayathumisa kepha ube munye lona lovete ukuthi kuthiwa asihlale emakhaya sichelelane kepha nyalo betempilo batongena lamakhaya uthi batawuletha leligciwane.
Awukuyajabulisa konke lesikuvile lana. I'm very happy with the response. I didn't know that they would welcome it so well. So it's the same thing nale makhaya nakhona besikuthatha kanjalo. People are very welcoming with everything. Kunamunye lana lothi thina sitawuletha le COVID lekuya.
Kunjalo.
Yes, this is ngiko lokhu kunye lesikile sakuqabanga. We've taken a lot of people's thoughts around and hearing ukuthi batothini. This lokuthi thina sitawuletha COVID. This is a misconception. Ngenxa ukuthi thina nasifika lekuwe sifuna ukukumitha ngaphandle kwelikhaya lakho.
Yes.
Outside your home. Lekushaya umoya khona sima a meter apart, a meter to 2 meters apart, sicocisane nawe ngalendzaba le COVID. And sonke thina belitiko letempilo sitabe sigcoke imask. And nangabe kutawenda ukuthi tawudzinga ukuthi sende imaswabbing nako konke tawufaka N95 which prevents almost 100% bugs from coming in. So ukuthi thina sitayiletha nalokunye lesifuteke sikubike ukuthi nathi belitiko letempilo thina sibhala ema-symptom diary. Ma-symptom diary ukuthi njalo ekseni nakavuka dokotela noma nesi kuthimini yami siyabhala ukuthi uvuke namhla ufila unjani, unemkhuhlane kuyahayida lana, mafinyela yaphuma, you write that down. Once uva ngathi hayi ngathi sekukabi nyana ngathi sekungena umkhuhlane, we will take you and isolate you. Ngeke uye fielding. Yes, because why? Asifuna ukuthi uthelele labanye labasebenta nathi, because that will reduce the workforce yethu. Because thina lesikufunako kahle kahle sifuna lokusita emaswati kahle kahle. Yes,
losho ukuthi nje lona wekunene angakhululeka ukuthi angeke nibalethele iCovid
lamakhaya. No,
lamakhaya.
angakhululeka ngeke sikwende lokho. There's 100%.
Okay, kuyevakala dokotela njengoba lo mkhankaso uqalile itolo niyangena ngabe iresponse kubantu banemukela njani? How is the reception and the response to this campaign?
Okay, thank you very much. So the reception and the response to the campaign is very well. It's almost the same as the videos you just showed me. People are welcoming and they want to learn more about COVID-19. They have been listening about COVID-19 for the past 2-3 months since it has started in Swaziland more vastly. And they want to learn more and go to ilashwa njani, and they want to ask us ukuthi kulqiniso yini lokhu nalokhu, because they hear a lot of things in the community njengalokho ukuthi thina spreader iCovid asikwendi ke lokho. Yes.
Kuyevakala dokotela mbukeliso lo sikulo luhlelo lapho sikhulumisa khona tindzaba temkhuhlane iCovid-19. Namhla ke sibuke umkhankaso lo sikunyiswe litiko letempilo lapho litiko lihamba door to door esifundzeni sakamanzini kutama ukukhulumisana nabantu ngemkhuhlane iCovid-19. Kulesikhathi sanyalo sitawuthatha likhefu mbukeli sathina sibuya sitabanaye ke umphathi wesifundza sakamanzini umfana Nkosi Chief Gija elicingweni naye sitowuva umuvo ukuthi ngabe balibandla lelibuke kulwa nemkhuhlane iCovid-19 kamanzini bathini ngalomkhankaso nokuthi sive bangasikhutsata bathini. Mbukeli asithathe likhefu sijikete itolo.
Ngicabanga ukuthi maybe kungaba ukuthi uhulumende maybe bantu abanikelele maybe ngawona lawo mamaski ngicabanga kwami.
Ukucabanga ukuthi mhlambe kungasita kithi sisive lento sina ukuthi yabona sisithathele phansi sina labanye singayikholelwa ukuthi abona nje ikhona into le bangasita nje ngayo labatempilo ngokuthi basincedise ngaloko ema-sanitizer, basifundise ngemfundo yakhona lokuthi yabona kwento kanjani ngalesifo.
Ngozi mina litiko ngemuvo wami litiko liyasho ukuthi okay lokuyilonga sida lokudla lesikudlako akusiko kona lesikudlako lokubhlungu solo vele satekwansi COVID-19 kulaka amanzini lotshwala beyavala but nongathi uyangena ngemiti kukhona sendela abantu
Bantu badzinga ukuthi bashunyayelwe baze beve. Ngaba mqokwa ukuthi bahambe bonkenwa lapha emakhaya kushunyayelwe nevangeli ukuthi balekelani nabo yentani kanje nako lokungasidi.
Yabona bangene lamakhaya ngoba kunebantu labangakhoni nalokuthi abona nje bahambe.
Bekende kahle le lockdown beyivuma kona kuyinkinga bakuyalanjwa ukuhlala ekhaya ungadli but nebambu labasuke kanje kuseni bahambe bangathi bayapi bahle benyuka estrad gcwele nje bamfana iniyonke lendlela yabona ngawo labanzisa lekugula futhi yabona ngathi uhulumende uma ngaphinza aphakamisa noma abuyele lamaphoyisa lamgwaqeni abuyele futhi anciphise labantu bahlala emakhaya ngaba ngcono lokho.
Mbukele ekhaya imivo yesive nayo so sita kumbe netincomo nema suggestions ukuthi ingabe vele yini lokungendiwa dokotela bayativeta tincomo tabo sive. They're making their suggestions. Some are saying maybe we should reintroduce the stricter measures maybe of the partial lockdown.
Okay, I think that's a very good idea because we need to have that because people usually respect police more. For instance, and they are very afraid of police. And I've noticed recently ukuthi emaphoyisa emgwaqweni sekancipha but ngive ukuthi sekatophinza abuye nalokuthi emadorobheni sebatovala titolo nako konke ngenxa yokuthi le COVID seyenyuka phinzi. So it is important ukuthi emaphoyisa aphinze abuye asisite nathi belitiko letempilo sisebente kanye in order to get the curve.
Kuyevakala nje dokotela sisakhuluma lendzaba nihamba la door to door umbukele ekhaya solo sigatheke kuthola yena umfana inkosi wesifundza sakamanzini ngabe ema challenges lenisahlangabetana nawo so far yini?
Okay, challenge ekala lesihlangane nayo mostly kulamalanga is ukuthi asibathola labantu labadzala lemakhaya sivamisa ukuthola labantwana nalabo helper nabo sisi labadzala. So sifuna lokuthi sibathole bonke labantu. So what I was suggesting ukuthi sikwende ukuthi siscreene nala misebentini ukuthi sithe misebentini sifundzise khona sendele FTs nakhona ngenxa ukuthi some of them asibathole emakhaya so the other place where you can find them is at work with their workmates because nalapho it gets spread there akusiyo emakhaya kuphela
kanzi le information dawukhanza senifakile ekhaya nasafika lo mdzala senguye maybe lo tawubeka labala ekhaya engotini
bathi yeke nandidlala nina khumulana ema-mask endlini kani nguye lo letha le COVID bese yabathelela.
Yes, utsinza nje indzaba yema-maski endlini doctor. We have seen a notion that there are transmissions that happens within the family structure because we feel like I'm with my family so I cannot wear the mask. What advice can you give to families with regard to that aspect?
Okay, we've seen a high rise in the family, like a whole family getting confirmed positive. What advice I would give with that is ukuthi sisebenzise lama mask noma nasendlini siyadla sonke okay sihleli lounge asihlaleni sibukele TV but sigqokeni lama mask ngenxa yokuthi all of us are going to different places. Babe uyahamba uya kamanzini maku uyahamba uye emarket uyahamba udobha le COVID uletha uthelela bonke labantwana labala endlini na andi lohlele endlini. So it's best ukuthi we work with all the measures that we can. So endlini let's all try and wear the masks and then nanibuyela emakamerweni bese niyakhumula.
Okay. Sibonge dokotela mbukeli ekhaya sesinaye umfana inkosi Gija umphathi sifundza sakamanzini mfana inkosi sikwemukele eluhlelweni.
Sivusele Ngubane singavusela sibe semaswati.
Inkosi sibonile lana litiko letempilo lisukumisa umkhankaso lesingathi ngesilumbi yi door to door lapho khona betempilo bahamba bangena lamakhaya kutama kunciphisa kwanza kwalomkhuhlane kwatise ukuthi sifundza sakamanzini sibonakele ukuthi kumbe ngilapho lomkhuhlane wanze kakhulu khona ngabe nilibandla lelibuke kulwa nalomkhuhlane kamanzini nithini ngalomkhankaso lona?
Asibonge Ngubane ukuthi ukuvete lokho ubutela lesive semaswati sonke vele lo mkhankaso osukumile and siyawusekela besikhona nakhona betempilo bawusukumisa siyawusekela ukuthi vele awuqhubeke empeleni sikanye nabo nanathi lokuthi awuqhubeke bangene elikhaya ubona kakhulu bafuna nekusita amaswati amaswati akavula iminyango badoba testa babona ukukhona ngoba kuyenteka ukulayisha ungaboni ukulayishile lokugula ulana iminyango maswati lamahle kuze ukuthi batontinza baka health banihlole ukuthi ninako noma nide nawunako utoshesha usitakale ungakatheleli labanye ngoba lesikulwako lokuthi noma ungakaguli ungakatibonisi unako ungakhala sokuthela labanye lakagcine nasheshe agule sithi ke maswati lamahle akasukume avula iminyango baka help babacheck bente konke babafundise balalele thina ngala asike mithine vele sisukumile nathi siyahamba singicela kungena ngesikomu ngeminyango ngelikhana nathi sineke sichecka ngalokunye asikho la testena asikwati testa sine checka lokuthi uya comply yini na ungacomply angivele ngisho maswati amahle ukuthi vele sesawusebenzisa i-operation bopha nako sitolo sitawusenza i-operation vala nabe awendi kahle lokho ngizanguvete lokho maswati namahle ngikukahle
Kala Nkosi nivetile ningimanzini ukuthi nifuna kungena njengoba uthi senicalile kunenzaba kumbe yetshwala lebonakele nayo ukuthi kumbe kunenzima thite leyidlalako ekwanziseni leligciwane nithite ningimanzini nitawungena lamakhaya niphikithe tshwala ngabe senilicalile yini lolo hlelo noma loyo mkhankaso
angibonge ngubani ukuvete lokho nako lo mkhankaso sesiuqalile asisho ukuthi amaswati akabe geared athi sivele theater siyangena sesicalile ngempela sonto nje emaphoyisa bekaqale asebenza atinikele ngawo onke emandla awo noma kunengoti lenjani ase sidawufa lapho level litawufa khona aphumile angene emaphoyisa batawusho la kufikile kubo sathi siqale vele nako siyangena sithi wonke umuntu nabu beke tshwala bukhiphe wakethe ubusarende ngoba vele singabukhanza nalo licala kuwe ngoba sibonile iqiniso lonke liphelele sibonile nase athi uhulumende bekunene siyabonakala lokuthi ngathi siyehluleka lokuthi sibunase responsibly tshwala phela sibalithola bebethu ukuthi sibunase kahle uhulumende uyasikhulula cha singathenga tshwala sibunase kahle nalo uyathenga amabhodlela amabili asiphothise ekhaya kodwa sakhombisa kungabi responsible lendlela lesinathengayo kwasi uma ligciwane lilayidulu ngoba ngilapha wathi uhulumende asibuvale tshwala bume vele ngoba kuyabona ukuthi asikhombisi kuba ngilabadala nathi lesibonile ke busupply ama-box store but nyalo ngiyeva lihinyana lelikhulu lethi empty ama-box store la kusafaye khona nyalo bushiftiwe bungale makhala kuthengiswa khona ibhodlela liyalabhiya selithengiswa ngabo-50 emalangeni kwendwe emaphathi ngalela vele siyasukuma siyakhona lokho sekuqaliwe enesisaqhubeka ngelikhaya
ikevakala Nkosi siphize sanibona ningimanzini nivale emanzini isikhathi lesingathi ngema-hour lasithupha ngabe lokho bekuyi once off campaign noma yindwo le ndawuhlale niyenta njalo kude kumbe kubonakale ukuthi leti nombolo setiyehle
nako lokho ngiyabonga ukuvete asibonge nje kubosomabhizinisi sibonge nebe-transport sibonge nawo onke amaswati lahlala kamanzini nalendlula kavakashele kamanzini endlule ngakhona ukuthi asihlonipha ngalesisonto liphelile lapho sisho khona ukuthi sisacela ukuthi imitamo leminye sifuthe lidolobha sifuthe tinza lapho kuhlala abantu khona ukuthi nabe likhona ligcone lelibekeke lapho silibulale nalelinye litawuhlale likhanzise kunalo muthi nalo sheshe life vele akusiyo into ya once off ukuthi kwenteke just that Sunday and that's it ngeke saphinza vele nayisekhona imithi labasipha yona abantu benkosi sidawube sichubeka njalo kube siyakhona ngabe sithi every Sunday siyafutha but sekutaba ukuthi imithi khona yini sesitawubekisa nje kwendlule lisonto mhlambe lesibili lesithathu sifuthe futhi njageni ngeke bendleke ukugcina siyacela ke nabo somabhizinisi nabemakhumbi betransport abafuthi bafumigate emabhasi ngekhathi kuze bekunene sitolwa nalegciwane bemabhizinisi ngekhathi isitolo sabo ngekhathi ema-workshops emafemini abo abafute nabo kubulala igcwane lengabe singenela lo ngekhathi alingangeni umuntu alikhanze uma kuphuma umuntu nje aphume nalo abafumigate nanabo nesihlahle sithathu la ngaphandle sifutha khona kuba
Kuyevakala Nkosi kumbe sesengasekugqineni siyabona uyafuthwa manzini kepha leti nombolo tikhula kumbe kuleti ndzawo letimaqiniselo ngabe lapho kukhona ni kumbe tinhlelo kumbe ningimanzini lentibukile ukuthi nisonzele kubozakhele la kubonakala khona nifuthe kumbe kuleti ndzawo lapho khona kugcwala abantu.
Ngiyabonga ukuveta nako batawufakaza bebakhona vele asifuthe idolobha nje la ngeke edolobheni kuphela siyathi edolobheni sifutha everybody uya edolobheni ayothenga endlula kulezi ndzawo lapha kugcwala abantu khona bokubhasa zonke benqa khona abantu vele besifutha nakashali ezakhele yonke ndzawo tawufutha nakukhoza lapha etimarket lapha kudlula abantu khona labaningi khona senyukela konke ngihla kuba morning la siyakhona sesiphophela ukuthi next sesiyofika kubomathapha kubomalkensi izama yonke indlela ukuthi livele Nkosi alihlobe njengoba inguyami ishito ukuthi asini 2022 akungafika umnyaka afike thina siphilile ku2022.
Umbuto wegcina nje noma kukhutsata sive sakamanzini ukuthi sibambise nali litiko letempilo kulomkhankaso we door to door basahamba bazama kona kusita sive kulomkhuhlane.
Kukhutsata bekunene ngithi nje mine lokho indzaba yethu sonke. Lokho i-concern ngumsebenzi wethu sonke kufuna sisukume sonke simaswati akungasukumi baka health nje kuphela ngumsebenzi baka health batowulekelela thina sihamba nabo batasikhomba indlela njengabantu labafundiswe ngetempilo wethu kusasume thina simaswati sibabute sente njani nakunje bataseluleka bese liyaphila live ngithi nje nemaswati akavula iminyango nabachamba ka health ababemukele bete kuletha impilo bete ukuxosha iCovid ikhweshe ekhaya.
Sibonge Nkosi kuba nathi eluhlelweni.
Siyabonga kube.
Dokotela loyo bekungumphathi sifundza wakamanzini Chief Gija ngabe kulala kushoko ungathini wena ni sahamba lomkhankaso.
Okay, la kushoko Chief Gija, it's very true. Ukuthi indzaba yethu sonke vele. Funele sisebenze kanye sisebenzisane sonke. Because thina singeta stoku explainela konke ukuthi yenda naku but if ungakwendi wena leligciwane litaqhubeka lispread la kangwane and lisicethe. But we need to work together and in order for the greater good and to stop the curve.
Doctor, we have seen several campaigns being carried out. The Manzini COVID team, or rather in all the regions, they've visited traditional leaders to capacitate them on COVID-19. Have those campaigns yielded positive results? And maybe with the door-to-door, how do you think it will be more effective maybe than the other campaigns that we have seen?
Okay, thank you for asking that question. So with the door-to-door, it's a very good addition to what we are having now. So there's Dr. Chirongo from the WHO. He has this example. Good, see, if you have a burning bush and you're burning lana na lana, asithi siyababela. Nasibabela, umuntu nakacisha ngalana kuphela, asithi i-door to door, cisha ngalana kuphela, umlilo uyachubeka ngalana.
Yes.
So nasibanengi sisebenza ngale COVID. The different campaigns, if we are all working towards the same goal, we will eventually cisha lo mlilo with COVID.
Shothi labanye babhula ngala labanye babhula
ngala. Yes, singasita nesonke. Nemaswati nawo futhi asijoyine sibhule sonke kanye.
Sakhuluma earlier uthinze indzaba yema misconceptions. We have heard a situation kumbe even ye HIV and AIDS. We understand kwangathi nalana sesifika kuleso sigaba.
Yebo njengoba ashito nje one of the people on the street would say some people bathatha le stigma say HIV say would say okay I cannot report my symptoms of flu-like symptoms because people will judge me. There's no judgment with COVID. We are all susceptible to it. Every one of us. I would say lona wende log na log. Anyone can get COVID-19. So what we are trying to do, we are trying to stop it. So if we come with the mentality HIV sesende kahle kakhulu la kangwane.
Yes.
We are on the top. We have reached 95,
one of the
95,
two countries
95,
in the world,
yes,
okay,
with Switzerland as well.
yes.
Which is a very good thing. So we need to do the same thing. We need to set the same example with the COVID. We need to work together and for the greater good.
Umuntu tatibuta ukuthi having done well as a country in the fight against HIV and AIDS, can we not take the model lesi sebende ngayo HIV and AIDS, and also maybe try to implement logo lokungaba relevant in the fight against COVID?
Yes, I think we can use that one especially because the main thing that is beating us now is the stigma and people thinking it's not a real disease. Kani COVID is real and it's affecting a lot of people and they are dying even. And we do not want that to happen. So we need to fight and we need to reduce the cases.
Yes.
But the main thing we need to fight on is as we've seen in other countries, it's been very devastating.
As we wrap up, Doctor, maybe besides the door-to-door campaign, what other strategies leniwa apply in terms of keep the spread of COVID-19?
Okay, other strategies, the main ones is just the education. Education is the main thing that will help us all. The door-to-door has the education, as we had said, effect. So the education is the main thing that will help us all, since each and everyone is responsible for their own health and the rest of us. So nangabe uvangathi uyagula, hambe esibhedlela ubike, noma ushayele 977 noma umele thina ukuthi sifike leyo region yakho. Yes. So it's mainly the education that will help us.
Just as a word of summary?
Okay, COVID-19 is a very serious disease and it's very infectious. I would like us to work together as eMaswati. Sipule lo mlilo kanye kanye. And then size simcishe. Yes.
So nakungakabanjiswana
ukuthi lesitakweni.
Sibonge kakhulu Dr. Sikhathi sakho.
Thank you very much, Ngubane.
Mbukele ekhaya loyo bekungudokotela Angelo Rodrick Shaw lohola ke emabandla lahamba lapha emimangweni kakhulukati kamanzini lapho lomkhankaso uqale khona kuhanjwa eminyango neminyango kungenwa door to door lapho khona ke kukhulunyiswa tona tindzaba te COVID-19 kuhanjiswa yona imilayeto yokuthi bantfu abativikele nangabe kumbe kunetimphawu tibonako ukuthi kwangathi ngenwa ngumkhuhlane bayachaza ke ukuthi thola noma ke lolo sito kube tempilo noma ke ushayele 977 kude ukwadi ukuthi uhloleke masinyane ngaphambi kokube uwanzise lo mkhuhlane kanti kolokunyele bakhutsatako yindzaba yokuthi nasihledi emakhaya asingayi ngekweukuthi singumndeni ngeke kumbe sisayilandzelela leminye yemigomo yekulwa nalomkhuhlane asati nje ukuthi vele noma ngabe sidihlobo sihlede ekhaya asitivikele ngoba asati lophumile wahamba waye emsebentini noma waye esitolo ubuya nani nasabuya ekhaya mbukeli lesikhutsatako kulolu hlelo ngiko ukuthi singamaswati asitivikele kulomkhuhlane sinciphise letinombolo letikhula njengoba tibonakala tikhula ngesivinini lesetulo kunamuhla ke mbukeli elihlelweni ngingusibusiso Ngubane nginaye Mbongwa Dube sithi nisale kahle.
COVID-19 ufuna khweshelele ndoseni ufuna kuvusela vuselele katsini ayakusekho khawula nana kusekho kabula lalela ngwane sivikela kufa
Say all you gotta do is just to wash your hands, social distance yourself from all your friends. You could save a
Sinibusele Maswati lamahle kanye nabo bonke abazalwane eveni laseswatini igama lami ngingayandazwane Health Promotions Officer walohlelo lolushasha lolubitwa ngekuthi Faith and Community Initiative kafishane FCI.
Njengoba sisho so